Welcome to The Reasons We Smile with Dr. Kvitko, the show that brings you man-on-the-street interviews, celebrity guests, groundbreaking research, and heartwarming stories about the reasons we smile. Our show is also known as everything you've always wanted to know about dentistry, but were too numb to ask. Hello, I'm General Dentist Dr. Kvitko, and thank you for joining me today.
The following views and opinions do not necessarily reflect those of this station, its staff, management, or parent company. To hear a replay of this show or one of the great shows that previously aired, log on to thereasonswesmile.com or iTunes, keyword Dr. Kvitko or The Reasons We Smile. Listeners should not use Dr. Kvitko's comments and advice in place of an actual dental exam.
Brighten your life with a smile that shows the professional touch of Dr. Kvitko.
Time now for The Reasons We Smile with Dr. Kvitko. Call 459-9769 to discuss your dental issues. Now, here's your host, Dr. Kvitko.
Hello, everyone. Welcome to The Reasons We Smile. I'm Dr. Kvitko. Thank you so much for joining me. This is episode number 494. I really appreciate that you've tuned in because today we are going to, in observance of Independence Day, we're going to discuss how you can gain your independence from tooth decay, tooth pain, bleeding gums, receding gums, swollen gums, mouth sores, and infections. All right. Our country obtained its independence from Britain in 1776, so let's talk about how you can obtain your independence from those things. All right. Now, before we get started, let me remind you, if you'd like to follow me on Twitter, it's at Dr. Kvitko, or if you would please go to my office Facebook page and like us, that would be awesome. And all episodes, complete with video, are available at thereasonswesmile.com. Okay, and you might want to check that out and grab some of the older shows. We get emails and tweets from folks every so often that tell us that they went there and watched them and enjoyed it. So we try to have some shows, some pictures, some things to make you, give you something to look at while you're listening. All right, so as I mentioned, we're going to talk about a lot of things, and they're going to be all beneficial to you as far as obtaining your independence from these dental things that nobody wants. Like, who wants tooth pain, right? Who wants cavities? Who wants swollen gums? I mean, I deal with this all the time in the sense that people wait, unfortunately. You've probably done the same thing. They wait until they have a toothache or some kind of swelling, and then they call, and then it's an emergency on Sunday or on 4th of July or whatever. All right, so let me just talk and say the best thing you can do if you want to gain your independence from tooth decay and gum disease is to brush your teeth. Sounds pretty simple, doesn't it? Brush your teeth. It's amazing. It does not take that much to avoid the dentist. But by the way, just because you brush, it doesn't mean you should avoid the dentist. I don't want to get those two things confused because it's very important that you realize that tooth decay doesn't hurt, doesn't heal itself. Gum disease doesn't hurt, doesn't heal itself. You don't know you have cavities unless your dentist has taken x-rays to see under the, peel back the layers. And so it's very, very important that you come on a regular basis. So yes, we're trying to put ourselves out of business as dentists. We have been for centuries, but we're not, so far we haven't been successful. Why? Because people are lazy, and you know who you are. So it's funny because my father told me that when I was in dental school, and there was some talk about, we're going to have dental disease cured, and we won't even need dentists come the year 2000. And of course, he said, don't worry, because people aren't going to do what they're supposed to do. And he was right. Okay, so the number one thing, although we're not tracking them in order, is brush your teeth. Okay, the next thing you can do to gain your independence from tooth decay and gum disease is to floss. All right, now, it's been estimated that if you don't floss, you're missing 35% of the surfaces of your teeth. 35%. For those of you that aren't math whizzes, that's more than a third. And maybe if you are a math whiz, but it's early in the morning, you didn't want to do math, so I'll do it for you. That's more than a third of the surfaces of the teeth. So if you don't floss, then those 35% surfaces are vulnerable. They're probably going to get cavities, which again, you won't know you have until it's too late. Okay, so remember that. The biggest keys, I think, that I've discovered over the years that I need my patients to know are some of the things I've just mentioned, and that is that tooth decay doesn't hurt. You will not know you have a cavity. Now, some of you are saying, yeah, but I knew I had a cavity because there's a hole in it, or it's like you didn't know when you got the beginning cavity, when you first got the cavity, when we can fix it when it's a tiny little filling. You didn't know you needed a filling until it was huge. Absolutely huge, right? And guess what did you find when you got there? You found that it was either going to have to come out or it was going to be a root canal. Am I right? I think I am. Okay. So those things are very, very important. And the next thing you want to do is, I think I just mentioned, is see your dentist every 6 months because you don't have any pain or discomfort. And that doesn't mean just because you don't that you're healthy. That is probably the key. I can't tell you how many people tell me, oh, nothing hurts, so I must be fine. When I come in and I tell them that, we're going to, I want to take some x-rays, we want to figure out what's going on in their mouth. And they'll say, well, everything feels fine, Can we just skip those? And the answer is no. Now, sometimes we get into a discussion because people disagree with me. They still feel like since nothing hurts, that they should be able to skip the x-rays. And that is actually number 4 on my list. Be certain you allow your dentist to take the x-rays that he or she wants on the regular basis that they think is appropriate. Okay? Because I can tell you, we see this stuff. We know when we see a small cavity on an x-ray today, we know what it's going to look like in 6 months, a year and a half. And by the way, some of what we know comes from what we know about you. We know that you don't brush and you don't floss. By the way, you're not fooling us when you brush and floss the 2 days before you come in. You haven't brushed or flossed for 5 months and 28 days. And then you come in and you're all clean. I bet every one of you have done this. And you know what we see? We see all this red gum where you can see where they've been mangled because somebody's like really brushing hard to try to get them clean so that we won't know that you haven't been brushing. But anyway, so we're going to take that and we're going to put it into our analysis of whether or not we should wait on a cavity. Okay? So remember, we want you to gain your independence from these things, from tooth decay and gum disease and as I mentioned earlier, swelling and mouth sores and bleeding gums and receding gums and swollen gums and infections, right? So it's very simple. Maybe not, it's actually more simple than it was for this country to become independent of Britain, right? We don't have to go to war. We just do it. Okay. So the x-rays, let me go back to the x-rays. I had a woman in about a week ago, and she is a cancer survivor. So she's had some x-rays in her life, and I know there are plenty of you that have had radiation therapy. And it was way past due for us to take x-rays. Our last x-rays were about 2 years ago. And she says, oh, well, I've had a lot of radiation. I've had a lot of therapy. And I'm going later today. They need to do a CAT scan for this or that. So I don't want dental x-rays. And I'm like, why? I didn't say it to her that way, but you're going to have another medical x-ray. Why don't you tell your doctor you don't want the x-ray if you want to save on x-rays, right? The other thing is dental x-rays are very, very safe. We have columnated the dose way down to a point where it would be something like you'd have to fly across country to about, let me think, it would be 11 times back and forth, maybe 5.5 times to get the same radiation that you would get from one dental x-ray series, a full series. Okay? And by the way, did you not know that you get radiation when you're on a jet airplane? Because you do. When you're up at 35,000 feet on average, you're exposed to gamma rays from the sun, which do the exact same thing as do radiation or x-rays on the ground. Okay? So, I've never met a person who was willing to cancel their vacation because of the radiation they might get while they're on a plane. Would you cancel your vacation? I don't think so. Well, you shouldn't cancel your dental x-rays because they're going to do wonders for you as far as helping you be healthy and comfortable and out of pain, okay? Or not have the pain in the first place. Okay, so I don't want to sound like I'm on my soapbox, but I am on my soapbox, folks. It's kind of my job, and it's not really a soapbox, it's a chair keeping me up off the floor. But it is. It's really something you need to kind of take to heart. And, don't think that dental x-rays are less important than the other x-rays out there. They're probably, in my opinion, they're probably more important. Why? Because too many people skip them. And then they get into trouble. And then it's like, oh, gee, now I can't afford the root canal. I'm looking at them like, well, I can't do it for free, so what are we going to do here, you know? And I'm thinking, not saying, gee, if you'd have done this a year and a half ago when I said you had a small cavity or a medium cavity, we wouldn't be talking about this, would we? Okay, and then we're going to do Dr. Kvitko's question of the day. Oh, you know what? Before I do, I just realized there's one more thing I want to cover, and that is, if your dentist says you need a root canal, filling, or crown, do not put off treatment. I just kind of alluded to it, but don't put it off. And the reason is because it's only going to get worse if you put it off. Okay? If we don't take care of it now, this root canal tooth is going to, that we're saying needs a root canal, is going to either get a cavity or it's going to break, it's going to split, it's going to maybe even break in half. Now you're going to lose it. So now you have to have it out. That's going to cost more to put an implant in. You can't wait on a tooth that needs a root canal if it's not hurting you yet, because it will hurt you. And if you wait, well, now your emergency that happens on Sunday may not be perceived by an emergency by your dentist, who's going to say, okay, well, let's get you in on Monday. Now you have to suffer the entire weekend. To be honest, I don't do that. I do have a 24-hour answering service and a pager and assistance on call, but I'm unique. Not many dentists do take care of people over the weekend or on a holiday who are in pain. I sometimes think I'm the only one. Okay, so yeah, every week we do a Dr. Kvitko question of the day, and what I'm going to do, here's the phone number. Pre-program it into your phone, 614-459-9769. So go ahead and pre-program 614-459-9769. And then you can just hit send when we're ready. But before we do the contest, we'd like you to listen to this.
This station will not be held liable for any contesting during The Reasons We Smile with Dr. Kvitko. Participation in the contest allows Dr. Kvitko to record and broadcast your name and call. One winner per household. Prizes are non-transferable, cannot be substituted, and are subject to taxes and fees. This station cannot be responsible for the inability to enter the contest, whether due to equipment malfunction or telephone difficulties. All decisions of Dr. Kvitko concerning this contest or eligibility are final.
And now it's time for Dr. Kvitko's question of the day.
All right, and I forgot to mention what the prize is. The prize is free flowers, a free floral arrangement from DeSantis Florist. They're going to be, it'll be delivered to your place of business. You know what? We normally say Tuesday afternoon, but because that's a holiday, it'll probably be Wednesday afternoon. All right? So, okay, here's the question. Today we're talking about gaining your independence from a host of dental issues. What are some of the ways you can do so? A, make sure you are brushing and flossing properly 3 times a day. B, make sure you visit your dentist every 6 months for an exam and cleaning. C, make sure you allow your dentist to take x-rays on a regular basis. D, if your dentist says you need a filling, crown, or root canal, do not put it off. Or E, all of the above. All right, the winner's going to receive free flowers from DeSantis Florist. They'll be delivered to your place of business this Wednesday afternoon. The number to call is 614-459-9769. That's 614-459-9769. So go ahead and call now.
You won't believe it though. I wanna hear your mind, and there's nothing else in the world tonight. She said, people don't take the time. Hey, people don't take the time.
Hi, I'm Keith Carlos, winner of America's Next Top Model and star of Chocolate City 2. Look for my smile on the big screen this summer, courtesy of Dr. Kvitko. Stay tuned to The Reasons We Smile with Dr. Kvitko, the world's most interesting dentist.
Hi, I'm Dr. Kvitko, general dentist and host of The Reasons We Smile radio and roadshow. Did you know that you no longer need to visit several different dental professionals to get more complete dental care? We handle everything from cleanings and orthodontics to restoration, implants, and smile makeovers, all in my office. And now we have 2 locations. Get the most advanced technology and procedures available today. It's more complete dentistry.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
Dr. Kvitko, let's go!
Hi, this is Richard Simmons. Dr. Kvitko's here, and he's going to help you with all of your problems. Are your teeth yellow? He can fix that. Are you missing a tooth? He can put a new one in. How is that?
That's very good. Thank you, Richard. back. We're doing Dr. Kvitko's question of the day. We have Holly, Sue, Linda, and John on the phone, and our first caller was Holly, so let's go with Holly. Hey, Holly, how are you? Hello, can't hear her. Okay, Holly, you there? I see the light blinking, so there we are. Are you there, Holly?
I can hear you.
Okay, awesome. Thank you so much. Hey, what is the answer to Dr. Kvitko's question of the day?
E.
E, all of the above, right?
Yeah, all of the above.
That's right. Hey, Holly, what do you do for a living?
I'm a registered nurse at OSU Medical Center.
Oh, okay. Okay.
Yeah.
Awesome. So you're up early because people are getting registered.
Well, I just got off work. So
Oh, you just got off.
Yeah.
You worked all night. Oh, man. Oh,
Yeah.
man. Okay. Well, thanks for what you do. And thanks for listening. And stay on the line, though, because we have to get the address where we're going to send those flowers this Wednesday, okay?
Okay, thank you.
Thank you, Holly. Take care now. Okay, so while my producer is getting her information, we're going to talk more about these things that you can do to gain your independence from things like tooth decay, gum disease, swelling, infection, mouth sores, receding gums, swollen gums, all of those things. Nobody wants that, right? Okay, one of the other main things you can do is don't smoke. Don't smoke. Smoking decreases blood flow in your mouth and makes you much, much more susceptible to gingivitis and periodontitis. Now, gingivitis is something that is just when it is just affecting the gums. Periodontitis is when the inflammation is now affecting the bone. Okay? That one being the worst one because now you have receding gums. Once your gums recede, you have exposed root. That can be sensitive. It's more susceptible to decay because roots aren't designed to ward off decay, right? They're supposed to be under the gums, so when the gums leave, well, there you go. Now you have all this acid and sugar and all that stuff on the roots, and so it's easy to get decay on those roots if you smoke. And smoking also stains your teeth, and if you have stained teeth, the surface is more rough, and it makes it easier for food and plaque to attach. Smoking is just overall bad. I mean, even when you smoke and have to do an extraction, you're more likely to get a dry socket because of that decreased blood supply. It's just a whole cascade of things that happen. So don't do that, folks, okay? All right. Another is don't put a pinch between your cheek and gum, okay? Don't do chewing tobacco. Don't do snuff. We weren't designed to have that stuff sitting there. And, I mean, if you want to give yourself oral cancer, there you go. That's what you do. But who wants oral cancer? And I'm telling you, the people that I've met that have it, it's terrible. It is not something you would wish on your absolute worst enemy. It's a terrible way to die. And but you will die if you get squamous cell carcinoma in your mouth. It's very aggressive. Yes, there can be cures. There can be people that can be cured. Sometimes, though, the cure is really tough because they have to remove your tongue or part of your tongue or one side of your jaw. You get scar tissue, follow-up surgeries. Before you know it, you can barely chew. The quality of life just dips really dramatically, and it's something that you definitely want to avoid. Okay, and then here's another. Have your impacted wisdom teeth removed before they become sore, swollen, or infected. Again, I can't tell you how many people I say, oh, you know what, this wisdom tooth, it's impacted. It's never going to come in. There's no room. It's leaning up against the other tooth, and we need to get it out. And they look at me like, doesn't hurt. Folks, stop telling me it doesn't hurt, because when I'm telling you have issues, whether it hurts or not is irrelevant. Okay? It's irrelevant. I wonder if there's ever a woman who was diagnosed with breast cancer that looked at the doctor and said, but it doesn't hurt, doc. It doesn't hurt. Why do we have to do anything? It doesn't hurt. Okay? To me, it's very simple. You have had a disease process identified in your mouth, and now it's time to act. Now it's time to get it taken care of. All right? I mean, doesn't that make sense? It's like telling me that it doesn't hurt doesn't mean you don't have it. Okay? So, looks like it's time for us to go to a break. You're listening to Dr. Kvitko. It's episode number 494. This is The Reasons We Smile, and we'll be right back.
You can't take me as I am, not just a little bit. I don't know who to be. I'm a paper cup, baby, of the sea. I know you see it too, 'cause you're too much for me.
This is Clark Kellogg. Stay tuned for more of Dr. Kvitko.
Estás escuchando con Dr. Kvitko aquí en su estación favorita.
Hi, I'm Dominique Reichert.
Like what you hear? Why not use the show to promote your product or service by becoming a sponsor? Call 614-262-9588 to learn how. That's 614-262-9588. Call now.
Hi, I'm Dr. Kvitko, general dentist and host of the Reasons We Smile radio and roadshow. I've been honored to help several famous people get a perfect smile, like Keith Carlos and Dominique Reigard from America's Next Top Model, and Ted the Golden Voice Williams from right here in Columbus. Isn't it time you had a celebrity smile? It costs less than you might think, and most of the time, it can be done in one visit. A new smile can make a world of difference.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
I'm Grandpa, and I go to Dr. Kvitko, and I still have all my teeth. Real ones. Where's my glasses?
If you're just joining us, I'm Dr. Kvitko. This is The Reasons We Smile. It's episode number 494. Today we are giving you tips about how you can gain your independence from a host of dental problems. Okay, we're trying to make your life better, and I consider this kind of a self-help show. And although you can't do your own dentistry, people have tried without success. I've seen some YouTube videos. I think I even played one once of this gentleman that was trying to pull his own tooth, and he was getting himself drunk, and his wife was egging him on, and not a good. It was like the worst blood-curdling scream I've ever heard, and that was supposedly after drinking a bunch of whiskey. So yeah, you don't want to do that. And remember, I said, your mouth is the only place in your body when you get disease it won't heal itself, right? If you cut your arm, whack your arm, break your arm, all of those will heal themselves. You don't even have to go to the doctor if you don't want to. I'm not saying you shouldn't, because obviously you want your arm, the bones to be set and all that. But the reality is if you don't get to the doctor, it's going to heal itself. You get a cavity, it'll never heal itself. All it can do is get bigger. You get gum disease, it will never go away on its own. All it's going to do is get worse. Okay, that's the reality, folks. So, that's why we're here trying to help and make sure you realize this, so you're not sitting around thinking that you're fine or thinking that you're going to heal. It doesn't matter what supplement or vitamin you take. Doesn't matter what homeopathic method you find online or any product in any drugstore. Nothing will cure dental disease except intervention by a dentist, okay? And hence what my father said, don't worry, you'll always have a job. But we are still trying to put ourselves out of business. We would much rather people come in healthy and we just clean your teeth and say, hey, you're doing a great job, no cavities, see you in 6 months. That's an awesome visit. I love that. I hate being the one to say you need a root canal because you have an abscess. Or even worse, I hate being the one to tell someone they have oral cancer. That is gut-wrenching. I hate that. The last time I did that, it was a 29-year-old. He was about 4 days shy of his 30th birthday. And he's not. I don't think he made it. Okay, a couple others we're gonna bring to you is don't be fooled by mouthwashes that give you that clean and tingly feeling. You know what the clean and tingly feeling is? It's a mild chemical burn. That's it. It's a mild chemical burn. I see that too on people that are coming in for their cleanings. We look on their cheek and the whole inside lining is like peeling off because they've done so much mouthwash in order to. Maybe they don't want to offend us with bad breath, which we appreciate. Or it could be that they're trying to cover up for 5.5 months of not brushing and flossing. But the point is it's just peeling off the inside mucosal lining, and it's not really it's not cleaning anything. It's just making you think you're clean. By the way, toothpaste does the same thing. You can brush your teeth without toothpaste, and there's something to be said for trying that on occasion, because then you'll know if you're getting it all off rather than having the clean feeling that the toothpaste chemicals give you. Okay? So another one, and you may not think of this as one that's going to help prevent things like tooth decay, gum disease, swelling gums, receding gums, etc. But another one is if your teeth are crooked, get them straightened. Doesn't matter if you're an adult or not. Why? Because when your teeth are crooked and I take an x-ray, I can't see between them. They're all overlapped. I can't tell if you have a cavity or not because I can't see in between. The other thing is when they're crooked, you can't brush as well. You can't get in there with your brush. Hard to get the floss in there. So now you're leaving yourself more prone to getting tooth decay that we're not going to be able to pick up. So even if you're coming and saying, take all the x-rays you want, Dr. Kvitko, I may not be able to see this. Eventually, I will see it when it gets big enough, but if it's straight, I can see it when it first happens, okay? So braces aren't done for cosmetics. Yes, you look better when we're done, but that's not why we do them. Think about it. If it were, no insurance company would ever pay for it, right? Because they'd say, well, we don't cover cosmetic things, okay? So they understand that straight teeth work better together. They have better shapes, better form and function. Food doesn't get impacted in areas where the crowding is, and it's easier for you to get the food out in the first place. And so straight teeth are healthier. Now you're also thinking, I'm adult, I don't want to have braces for 2 to 3 years. Well, maybe you've heard that I do a thing called 6-month smiles, where we take adults and we can straighten their teeth in about 6 months on average. In my office, it seems to be more like 4.5 months. I would say our average is probably 4.5, not 6. And all you do is you come once every 2 weeks. We'll adjust these brackets and wires, and we will get those teeth straight, and then you'll be able to care for them better, and then you're not going to have to worry about missing things, us missing things, okay? So it's actually pretty simple, and, you know, I know people think dentistry is expensive. Well, I'll tell you what, not as expensive as neglect, right? Because it's the neglect that runs the bill up, okay? So if you want to keep your mouth healthy and you want to have independence from all of these terrible things we've mentioned, all of the host of problems that, you know, people face in their everyday lives when it comes to dentistry, then all you have to do is do your part, and you're going to save a lot of money, okay? So, you know, if you put $40 in an envelope every month, you're going to be able to cover the cost of 2 dental cleanings in a year and x-rays every 2 times, okay? So that we can keep up on your x-rays. And then if you happen to have a cavity here and there, fillings range from, I don't know, under $200 to just over $300. And, you know, keep in mind, root canals cost $1,400 or $1,500. And crowns cost between $1,200 and $1,400. So when I say, let's do a $300 filling rather than falling off your chair, you should say, wow, I'm glad I didn't need the root canal. Let's get that, you know? And it's actually very true. It's very true. So the dentistry then is not expensive. The neglect is. So if you wanna run that dental bill up, then just stay away. Stay away all you want. And then when you come, you're going to be... And here's the thing. I don't know if I've said this before, but maybe you didn't hear. When somebody's been away for 11 years, 12 years, 27 years, whatever, I have to tell them that their dental care is going to cost $27,000 to get them healthy. I'm just picking that number out of thin air. Well, what I usually do then is I take $27,000 and I divide it by the number of years they haven't gone to a dentist, and then the number of months they haven't gone to a dentist, and guess what number I come up with? I usually come up with about $35 to $40 a month. So that's pretty much it, folks. Can you afford $35 to $40 a month? I bet you can, especially if you want to avoid pain and swelling. Okay? So time for me to come off of my soapbox. I hope everybody has a wonderful, wonderful 4th of July holiday. It's nice that we can all get together, and nice that we can enjoy freedom and peace. Just think about this. We can get together with our families, and we don't have to worry about bombs going off in the distance, or even worse, bombs being aimed at us, like people in other countries like Iraq and Syria and Afghanistan and so on. And so I want to thank all of our service people who are currently in the military for that. I want to thank all of the folks that have made that happen. All right, that's all the time we have. Don't forget to follow me on Twitter visit my office Facebook page. Remember that all past episodes complete with video are available at thereasonswesmile.com. Be sure to tune in next week and every week right here on your favorite station. Goodbye.
This is Carly Red from Love and Hip Hop Atlanta, the hit show on VH1, urging you to tune in next week with my dentist, Dr. Kvitko.
If you're interested in learning more about this and other dental health topics, go to thereasonswesmile.com to access full episodes of Dr. Kvitko's show.
If you'd like Dr. Kvitko, the world's most interesting dentist, to speak at your next event, please call 614-262-9588. That's 614-262-9588, or send an email to speaking@the